No way on Prop A.
ESD2 decided to resign from providing ambulance services starting in January.
First speaker, Jim McDonald.
Hyperbolic view, but if I were to get 2 calls and one of them is to a Medicaid recipient who, and I get a call at the same time for a call who's someone who's fully insured and able to pay for their bills, well, there might be a computer program that says which one gets priority.
If you have a Medicare patient and a commercial pay and some whatever in a computer system would send priority to the paid, that has been illegal for me. It's a federal crime. That's never going to happen. Its closest unit, it goes to that, based on severity, that can't happen.
Terry Lucas.
This is a forever tax. Largest tax increase.
The citizens need to be informed that there will be a significant increase in taxation. For just the city of Pflugerville, we don't have the ETJ calculated, it would be $1.8 million that they would collect.
Also, these ambulances are not guaranteed to be available when needed, nor will they be able to match the response times of our ambulance service now.
ESD2 was one of those organizations, disqualified themselves immediately at the beginning of the presentation, stating that they would not be able to meet the 8-minute response.
Chris Wolf.
None of the administrators of those companies are going to stand up here and tell you straight face they can provide the same EMS service that the citizens are getting from Pflugerville Fire Department today.
I can tell you that all other organizations not only said they would meet that response, but they will exceed it.
Ronald Cunningham.
Taxation without representation.
Mac Harrison.
Providing ambulance EMS service to Pflugerville. Before that, we had to wait to get an ambulance from Austin until 2017 when they started this ambulance service.
We could not find any statistical basis that Austin Travis County EMS was providing substandard care at that time. As a matter of fact, their response times exceeded those of the current system. In addition, we weren't able to find any statistical evidence that supported that care has improved since 2017 to right now.
Barbara Newsom.
The current firefighter-based EMS provides an excellent response time.
At the 8 minutes, based on the statistical analysis we did, it'll be 2 minutes faster than the current system right now.
Blake Brown.
How many ambulances are they going to actually put on the ground?
Here, as we look at where the EMS call volume is, the darker red obviously means there's more calls. All the way to green becomes very, neutral, and it's spread out accordingly. It is very clear that most of the call volume occurs the west side of the city. And we would recommend 2 ambulances on that side to deal with concurrent calls.
Trevor Stokes.
At that time, we had 50% of the time there was no ALS available.
I don't have anything to support that ATC EMS wasn't providing the same level of service.
First of all, the EMS valuation study is data from 2018.
The evaluation study was done on 2020 data, not 2018.
NFPA recommends 1 fire station per 10,000 people served.
That has nothing to do with EMS. That is for fire response.
Josh Stubblefield.
They will give them expensive bills and aggressively send those to collections.
75% of your constituents have the capacity to pay for medical care.
April Griffin.
I'm also a commissioner on Travis County ESD2.
ESD2 did not have a management or administrative experience to take over ambulance transport. Fire departments don't normally do that. It was out of their scope, it was out of their charter, and so consequently they weren't quite prepared to perform these kind of services.
Information was shared between the entities, including available options to address the EMS funding shortfall.
The city has options to provide EMS at no cost or very limited minimal cost.
These important life and safety services are all provided by Travis County ESD2 out of a fire department budget.
The numbers didn't line up and that additional funds were not needed to provide EMS.
Melody Ryan.
In the past 4 years since they took over ambulances from the county, the ESD2 reserves have doubled from $10 million to $20 million. ESD2 decided to resign from providing ambulance services starting in January. They update their forecast. Their so-called financial need no longer exists.
I'm Rich Buchanan with AP Triton to discuss the valuation study.
This provides them with information that allows the system to be sustainable.
Transport rates, one of the things we identified is their rates are out of consistency with the rest of the country. You no longer separate ALS and BLS when you're rolling a paramedic ambulance at all times. There's a lot of funding that is available. That was the most important thing, is you got to capture these dollars. They're already tax-based dollars in the state, and you have access to some of them, but it has to be done by a public entity. Then you should have a treat no transport category for the simple fact that insurance companies want to pay this. The basic total is, if you do nothing but fix the billing, I think they would be at $3 million, which would certainly cover the cost of providing service. I can tell you with great confidence that AP Triton has never recommended changes, had them implemented, and had it not remained solvent and sustainable.
ESD2 could fully fund all of their requirements just by adopting the billing changes that you recommended?
Yes, sir.
No way on Prop A.